This is your video on how to set up and shoot a bladder pressure. The bladder pressure kits are in the Pod 2 Omnicell, and if there is not one in there, you can have a leadership person get one for you. You need a liter bag of saline, a pair of sterile gloves, and some CHG wipes. Your patient must have a Foley. When you have the regular setup, you need a second person to come in and assist with you. What you're going to do is you're going to get your bag of saline. You're going to spike your bag of saline. To prime your tubing, it is a one-way valve, so all you have to do is push and pull. Oh, that's fine. You'll notice when you open the kit that your connections here are in a sterile container. So when you're priming, you're just going to prime it until it fills that sterile container. A little bit of air in this is not going to make any difference. You're going to have your second person come in. You're going to go through and put your sterile drape up underneath. You're going to don a pair of sterile gloves. You're going to have your second person clean your connection site there. And then this just rips open. Your second person can assist you with this. Just tear it open so that you can stay as sterile as possible. Just open all the way through. Okay. Once you have this ready, your second person is going to disconnect. You're going to put one end in there. You're going to put your other end in here. And now your system is set up and ready to use. Before you want to shoot a bladder pressure, you have to get this set at the mid-iliac crest. You're going to turn it off to the patient. Raise this up on a towel or some type of thing so it stays level. You're going to open. You're going to have this connected, as we always do, and you're going to zero. Once you have zeroed and you have your patient in a good position, your orders should say to instill 1 ml per kilo plus 2 mLs for a total volume. So if your patient will say is 5 kilos, we will pull up 7 cc's. Once you have your volume, you're going to go through and you're going to very quickly instill. That will inflate this balloon. After 30 seconds to 1 minute, you can look up here. And what you'll see is basically a flat line, and then you'll see a little hill, which is your respiratory. You want to read your bladder pressure on the flat line and not on the hill. You have 3 minutes total, so somewhere between the 60-second and the 120-second mark, you should be able to get a fairly accurate reading. Once you have gone through and gotten your number, after 3 minutes, this balloon deflates. and will let that instilled volume plus any residual urine drain into your urimeter. So when you need to record your bladder pressure, you need to actually add the bladder pressure row, and if you don't know how to do that in Epic, ask one of your senior staff and they can assist you with that. The other thing you have to do is you have to chart this as an irrigant in and an irrigant out. So it would be 7 cc's in, 7 cc's out. You also need to make sure you actually subtract that volume from your urimeter volume for the hour. So some other little things that are very helpful is if your patient is not going to tolerate laying flat, you can sit them up. The key is you need to always shoot the bladder pressure in the same position. They should be supine, and whether at 30 degrees or completely flat, just make sure you document in your nursing Cardex that you have positioned them in this way. The max volume to instill is 20 mLs. So if you have a large teenager, it will never be more than 20 mLs. And if you have any further questions on bladder pressures or setting up or recording or monitoring, please ask one of your equipment and technology people.